Hello everyone, this is Dr. Buddy Donaldson, and today we're going to talk about migraine and headache relief. Migraines and headaches create quite a burden on their sufferers, including an impaired quality of life, and can lead to aggravation, frustration, and depression. And in fact, it can affect family life because there are some mothers that are bedridden with migraines that cannot take care of their children because of the migraine pain. From a dental and facial perspective, we look at three things. The first thing we look at is the occlusion or bite. A malocclusion would be a bad bite, and this can create stress and dental wear on the teeth, causing facial pain. Here's a good bite, where we take a look at the teeth here, where the middle of the upper and the lower teeth match up, and we can take a look here where an upper tooth fits between the lower teeth. This would be a good bite. A bad bite would be one like this, where there's an open bite where the top teeth don't fit the bottom teeth, and you can get wear on the back teeth, and this can cause facial pain. Another bad bite would be a deep bite, where the top teeth overlap too much the bottom teeth. You get wear on the teeth right here, and it can push the jaw back because of the deep bite, and that can cause facial pain. So that's one of the first things that we look at. The next thing we look at are poor temporomandibular joint habits. Some of these include clenching and grinding your teeth, or putting your hands on your face. When you put your hands on your face when you're listening to someone talk, or if you're watching TV, or if you're sleeping on your hands, that can create pressure on your joints right here, on your temporomandibular joints, and that can cause facial pain. Another one is if you're sleeping on your stomach, and that too can put pressure on your jaw joints. A third contributing factor to headaches and migraines are the muscles of your shoulder, your neck, and your face. When you get these overstressed, let's just say for poor posture, if someone would have poor posture like this, you'll put pressure on your neck or shoulder muscles. You can get little what we call trigger points or knots in the muscles, and this can refer pain up, and you can get headaches there. So if you get trigger points or knots, what can happen is then you can have knots in your shoulders here, you can have a knot in your neck muscles back here, or you can have knots in your facial muscles. These all refer pain around here like this, and they can give you headaches. One man came to us frustrated. He had spent over $100,000 on trying to get his headaches under control. When we took a look, he had a very deep bite like this. His bite was too deep. Once we lifted the top teeth away from the bottom teeth, that took care of his headaches, and he could smile again. Another lady came to us frustrated and depressed. She felt like she'd gone everywhere looking for help, and no one could give her relief. Well, what we found was she had some very bad TMJ facial habits, like putting her hands on her face, sleeping on her face and stomach at night like this, and she also had knots in her shoulders, in her neck, and in her head. Once we got those under control, her facial pain went away. So, if you feel like you would like for us to take a look and we can see if we can help you with your migraine and headache relief, please give us a call and we will give you an evaluation. So if you have any questions, please give us a call.